Germ theory of disease was developed by a man named Louis Pasteur. It consisted of bacteria causing diseases. Louis was a scientist that has been studying his own theory in the 1800s. He figured out a cure for rabies by studying and experimenting on a variety of animals. During the discovery of his theory, he experimented the same way he cured rabies, by doing tests and experiments on animals. One of his experiments consisted of a bird giving birth and studying it while as it was giving birth. Louis Pasteur has changed the health and medical world forever because now people can survive and live longer so that our world can evolve even further. The theory was developed in the mid-1800s right after the acceptance in Europe and the United States. Discoveries made by many scientists also tested the theory by creating a microscope in 1677. Louis Pasteur and Robert Koch opened their work to research their causing of the germs and saved many lives. The original idea that Louis had was to improve the process of making alcohol, and he found out what was making the alcohol sour. It was the microorganisms. This is what gave him the idea that tiny organisms, known as germs, cause disease. The problem was that doctors weren't focusing on the real disease, only focusing on how to cure it or fix it. In 1871, the British government passed the Public Health Act because doctors were not using clean water and removed sewage. Rodents could also carry and spread diseases. Doctors worked on fleas, rats, and guinea pigs that carried ticks and experimented on them. Koch examined the blood of cows that had died of anthrax. He observed rod-shaped bacteria and suspected they caused anthrax. When Koch infected mice with blood from anthrax-stricken cows, the mice also developed anthrax. This led Koch to list 4 criteria to determine that a certain germ causes a particular disease. These criteria are known as Koch postulates and are still used today. Louis was born on December 22nd, 1822 in Dole, located in France. He grew up in the town of Arbois, and his father, Jean-Joseph Pasteur, was a tanner and a sergeant major dedicated to the Legion of Honor during the Napoleonic War. An average student, Pasteur was skilled at drawing and painting. He earned his Bachelor of Arts degree in 1840 and Bachelor of Science degree in 1842. Pasteur then spent several years researching and teaching in 1848. He became a professor of chemistry at the University of Strasbourg, where he met Marie Laurent, the daughter of the university's rector. They got married on May 29, 1849, and had 5 children, though only 2 survived childhood. Diseases were also thought to be caused by the supernatural and gods in ancient times. Spirits and gods were believed to make their presence known through disease. Treatment involved attempts to satisfy them with ritual, chanting, or sacrifice, though this was often combined with the direct treatment of the sick person. The Hippocrates theory is also an ancient system that many believed in. The Hippocrates system included the 4 humors that consisted of blood, yellow bile, black bile, and phlegm. This is what linked to Earth's elements of the human body to be in balance, and if this balance is lost, it causes sickness.
And that is with the supernatural view of disease. And the first form we could think of that in drawing our contrast, the contrast to what Hippocrates accomplished, we can see it in terms of the breakthrough from something that preceded it and went alongside it down to our own day. And this would be, first of all, the supernatural view of disease. That epidemics and pestilence are divine punishment, sent by an angry God for sin and disobedience.
Today we just do simple tasks like washing our hands that keep us from getting sick, but 2,000 years ago there wasn't any soap or water to clean our hands. Hand hygiene plays a big role in our lives today. If our hands weren't clean and we were to accidentally cut our hands, we would have gotten an infection that could possibly lead to death. The change which went into effect January 1st is intended to improve healthcare workers' compliance with proper hand washing. Poor hand hygiene of healthcare employees is considered a major contributor to hospital-acquired infections. About 722,000 hospital-acquired infections occurred in the U.S. in 2011, and about 75,000 people died with such an infection. The people die every day around the world from infections acquired while receiving healthcare. Hands are the main pathways of germ transmissions during healthcare. Hand hygiene is therefore the most important measure to avoid the transmission of harmful germs and prevent healthcare-associated infections.
Hello, I'm Dr. John Jernigan from the Centers for Disease Control and Prevention. Your doctor has chosen to admit you to this facility because you need high-quality medical care. The healthcare providers here want to do everything they can to help you get well and to avoid complications. You came to the hospital to get well, but you should know that each year in the United States, patients get more than 1 million infections in the hospital while they're being treated for something else. Examples of infections patients can get in the hospital include infections in their bloodstream, surgical wound, or urinary tract, as well as pneumonia. These infections can be serious and hard to treat, but there's one simple thing you and your family can do to help prevent these infections. Wash your hands and make sure that everyone who touches you, including your doctor, cleanses their hands.
The milk is heated to the appropriate temperature and held at that temperature for the appropriate time and then cooled. The cooled milk is then pumped out the vat to the rest of the processing line, for example, to the bottling station or cheese vat. Batch pasteurization is still used in some smaller processing plants. This is all pasteurization. The milk flow system is set up to make sure that the milk stays at pasteurization temperature for the appropriate time before it flows through the cooling area of the pasteurizer. The cooled milk then flows to the rest of the processing line, for example, to the bottling station. There are several options for temperatures and times available for continuous processing of refrigerated fluid milk. Although processing conditions are defined for the temperatures above 200 Fahrenheit, they are rarely used because they can impart an undesirable cooked flavor to milk.